Anthony Fauci, this nation's former top infectious disease official, was hospitalized this month with West Nile virus. A spokesperson said he was hospitalized for 6 days. He is now recovering at home, so he's apparently doing better. The 83-year-old is well known as the face of the response to the coronavirus pandemic under both Presidents Trump and Biden. He is expected to make a full recovery. Mosquitoes with West Nile virus are being detected all around the Bay Area this summer. The Santa Clara County Vector Control District says in just the last week, infected mosquitoes have been showing up in parts of San Jose and Palo Alto, other parts of the South Bay and the peninsula. This summer, a Contra Costa County man died after becoming infected. So for more on what we need to know about West Nile, we are being joined by Dr. Arnab Mukherjea. And Doctor, thank you so much. He is the Associate Professor of Public Health at Cal State East Bay. Thank you for doing this, Doctor. So we hear these stories, and good to remind people, but how worried should we be?
Well, unfortunately, sort of the world's most famous infectious disease doctor got this virus, so it brought it to the forefront. Thankfully, he's out of the hospital and expected to make a full recovery. Relative to other infectious diseases, West Nile virus is not a cause for concern. Normally in the United States, we see about hundreds to thousands of cases, which relative to the population is not a lot of cases. This year to date, we've had 216 cases as of last week in the United States. So on the lower end, and of those, in case you are wondering, 10 of those have been found in California.
Yeah, when you put it that way, it is not as alarming as some people might have thought, Doctor. Dr. Fauci is 83. As with a lot of things, is this more of a concern with the elderly?
I think with any infectious disease, the elderly, the immunocompromised do have a heightened burden of risk. On the other hand, I wouldn't say that this, of all the continuum of issues that the elderly face, I wouldn't say this would be something that people should be staying up awake at night. Because this is a mosquito-borne virus, as you said, human-to-human contact is almost impossible. The only exception being breastfeeding mothers to their children. So human-to-human contact is not an issue over here. So, most of these viruses these mosquito-borne viruses spread in the August to September months. We are just hitting the end of August, and as I said, we have only had 200 and some change. So I don't think this is something it's a cause for concern. Nonetheless, if you see yourself being exposed by mosquitoes or having a higher risk of doing so, it is diligent to take precautions to limit that exposure to mosquito bites, just like we would for malaria or any other disease that's spread by mosquitoes or other insect vectors.
So remind people, just to clarify, about the symptoms. Some of them can be very mild, of course. Some of them can be very serious. Remind people how to watch for those symptoms.
So I will say first and foremost that 4 out of 5 people who get infected with West Nile virus don't have any symptoms. Which is a good thing, especially given that human-to-human contact is near impossible. About 20% have symptoms that are consistent with the flu, so headache, fever, nausea, diarrhea, and in some cases a rash. So particularly if you've been exposed to a lot of mosquitoes and you see those things, it's prudent to get checked out by a doctor. Most cases, there is unfortunately no vaccine or no treatment, but most cases subside on their own in a period of weeks, maybe a month for those a little bit less fortunate. And the vast majority come out of it, just like Dr. Fauci, unscathed after the infection takes its course.
All right, so I'm curious, you point out, yes, no vaccine, no treatment. So what kind of care would Dr. Fauci perhaps have been getting in the hospital?
They would likely address his symptoms. One thing that happens with these types of viruses, particularly when you have nausea and diarrhea, you lose a lot of fluid. So he would have been getting supportive care just to make sure that his fluid intake is high and he's retaining enough fluids to make sure he keeps going. Above and beyond that, it would just be addressing symptoms like the fever and the headache. But it's supportive care, and just to make sure that, again, he's 83 years old, so that he's more than stable when he leaves, which he has, thankfully, and he should be on his feet just like most people in no time.
All right, Doctor, thank you so much for your time. And really, your information has been encouraging. I think people hear lots of stories about infected mosquitoes and maybe good to know about them, but maybe worry a little too much. So thank you for clarifying things for us.
Thank you for having me this evening.
Thanks, Doc.